You are eating well, you are staying active, you are enjoying a healthy lifestyle. But have you been screened for colon cancer? So, what is colon or colorectal cancer? Bowel cancer, also known as colorectal cancer or colon cancer, is any cancer that affects the colon, large bowel, and rectum back passage. It usually grows very slowly over a period up to 10 years before it starts to spread and affect other parts of the body. How does bowel cancer start? Most bowel cancers start as benign innocent growths called polyps on the wall of the bowel. Polyps are like small spots or cherries on stalks, and most do not produce symptoms. Polyps are common as we get older, and most polyps are not precancerous. One type of polyp called an adenoma can, however, become cancerous or malignant. Most people do not develop polyps until after the age of 50. Some polyps become cancerous, others do not. In order to prevent colorectal cancer, it is important to get screened to find out if you have polyps. 6 things that raise your risk of colorectal cancer. Age. The disease is most common in people over the age of 50, but younger people can get it too. Personal history. If you have already had colorectal cancer, you could get it again, especially if you had it for the first time before the age of 60. Also, people who have chronic inflammatory conditions of the colon, such as ulcerative colitis or Crohn's disease, are more likely to develop colorectal cancer than other people. Family history. Do you have a parent, brother, sister who has had colorectal cancer? That makes you more likely to get it too. If 2 or more close family members have had colorectal cancer, then you have about 15% chance of getting it at some point in life. Diet. People who eat a lot of fat, cholesterol, and little fiber may more likely develop colorectal cancer. Lifestyle. You are more likely to get colorectal cancer if you drink a lot of alcohol, smoke, don't get enough of exercise, and if you are overweight. Diabetes. People with diabetes are more likely to develop colorectal cancer than other people. Colorectal cancer signs and symptoms. A change in bowel habits such as diarrhea, constipation, or narrowing of the stools that lasts for more than few days. A feeling that you need to have a bowel movement but that is not relieved by having one. Rectal bleeding with bright red blood. Blood in the stool which may make the stool look dark. Cramping or abdominal pain. Weakness and fatigue. Unintended weight loss. And frequent gas pains. Common tests for colon cancer. Colonoscopy and sigmoidoscopy. This is a procedure in which a tube-like device is inserted to view any abnormal cells. It is also used to take tissue samples. Rectal exam. A gloved and lubricated finger is inserted to check for lumps. Fecal occult blood test. Samples of the stool are taken from the patient for laboratory testing to determine if there is blood in the stool. Barium enema. Barium is inserted into the lower intestine to coat all surfaces. Then, X-rays are taken to determine the presence of cancer. How can colorectal cancer be prevented? There is no way to completely eliminate the risk of developing colorectal cancer. That is why screening is so important. However, there is evidence that you can reduce your chance of getting colorectal cancer by doing the following. Have a diet that is rich in fiber. Eat plenty of whole grains, fruits and vegetables. Eat cabbage, broccoli, cauliflower and Brussels sprouts often. Avoid foods that are high in fat, particularly saturated fat. Eat foods that are high in calcium. Exercise regularly. Get educated, get screened for colon cancer. Please visit www.indiamedicalhub.com and share this video to help create awareness.